Medical billing and coding. Explained. What actually happens to your hospital bill. Most people never see what actually happens to their hospital bill behind the scenes. You check in, see the doctor, get treated, and go home. But your bill then enters a complex system involving coders, billing specialists, insurance software, and thousands of pages of federal coding rules. In this video, we walk through the entire medical billing and coding process, step by step, from the moment you arrive at the hospital to the moment the final bill appears in your mailbox. But first, you may subscribe to our channel and never miss another cool tutorial. Why this matters. Medical billing is one of the most confusing parts of the United States healthcare system. Every symptom, test, scan, and treatment is converted into standardized codes: ICD-10 for diagnoses, CPT for procedures, and HCPCS for supplies. This coding system is essential, but it also contributes to high charges and long, complicated bills. Once you understand how the process works, you can recognize errors, understand charges, and better manage your healthcare costs. Follow one hospital visit. Imagine a patient named Michael visiting the emergency room with stomach pain. After checking in, he gets his vitals taken, speaks with a doctor, gets lab work, and receives an abdominal scan. For Michael, the visit seems simple, but inside the hospital's billing system, every action is being tracked, coded, and translated into charges that will eventually show up on his bill. Step 1. Check-in and account setup. When Michael checks in, the hospital creates a patient account. This account records the reason for his visit, the providers he sees, and every service performed. His symptom of stomach pain is noted, but it will not appear on the bill until it is converted into an ICD-10 diagnosis code. Step 2. ICD-10 diagnosis coding. Once the doctor evaluates Michael, a medical coder reviews the notes and assigns ICD-10 codes. Stomach pain, for example, may become code R10.9. These codes justify the medical tests and treatments. Insurance uses them to confirm whether each service was medically necessary. Step 3. CPT procedure coding. Every service Michael receives is then matched to a CPT procedure code. A blood draw has a CPT code, the lab test has another one, and the scan has its own code as well. Even the doctor's visit is coded based on the complexity of care. CPT codes determine how much the hospital charges for each service. Step 4. Why a simple item becomes expensive. This is where many charges surprise patients. A dose of medication that costs only a few dollars at a pharmacy can appear as a much higher charge on a hospital bill. Hospitals factor in storage, pharmacy staff, labor, regulatory requirements, and facility overhead when calculating prices. These costs are built into the coded charges that appear on the bill. Step 5. Role of medical coders and billers. Medical coders translate provider notes into codes, and billers turn those codes into claims. They follow strict rules to ensure that diagnoses, procedures, and supplies are correctly represented. ICD-10 describes the condition, CPT describes what was done, and HCPCS codes cover supplies like crutches, IV bags, or equipment. Step 6. Insurance review and adjustment. After the claim is submitted, the insurance company reviews the codes and compares them to the patient's benefits. The insurer decides what to pay, what to deny, and what portion goes to deductible or copay. This information appears on the explanation of benefits. The hospital updates the account and sends the final bill to the patient based on the insurance adjustments. Complexity of the U.S. system. The United States uses one of the most complex medical billing systems in the world. With tens of thousands of diagnosis and procedure codes, the administrative load is high. In many other countries, hospitals use simpler systems with bundled payments or national fee schedules. Fewer codes mean fewer billing steps and lower administrative costs. The complexity of the U.S. system is one reason healthcare administration is more expensive compared to other nations. One last point, this video does not provide medical or financial advice. Always do your own research and consult with a professional for your specific situation. Understanding how your hospital bill is created helps you read it, question it, and catch errors before paying. If you want more breakdowns of complex healthcare topics in plain English, subscribe to the channel and share this video with someone who has ever been confused by a medical bill. The more you know about the billing process, the more control you have over your healthcare costs.